some focus points that I really need you to focus on would be most missed areas would be make sure that you address the client, the patient on the bed, or the proctor, which is also the evaluator. Make sure you state your name. Hi, I am Carolyn, and what would you like to be called, or what is your name? The proctor will state her name, or the patient on the bed will state their name. Another area where people really miss in hand hygiene is keeping your hands below your elbows. Make sure you keep your hands down at all times below the elbows. And then after 20 seconds of friction of your hands, clean your fingernails last. Clean your fingernails last. Those are most missed areas. Skill number 2 applies one knee-high elastic stocking focus point. You want to make sure, very important, that if it has a hole in the front of the knee-high elastic stocking, that the hole is either over the toes or under the toe area. Focus point for skill number 3, assist to ambulate using a transfer belt. We want to make sure that when you go to lift them up, that you grab the gait belt, the transfer belt on both sides using a scooping method. Your hand should scoop under the belt, not over. Skill number 4, assist with the use of a bedpan. Focus points. Make sure that once you place that bedpan under their bottom, those gloves are contaminated. You want to remove those gloves immediately and say, wash your hands. Then another focus point where most people miss on this skill is once you dump the contents of the bedpan in the toilet, the bedside commode, you want to make sure you rinse it, and don't you dare dump that water in the sink. Dump it back in the toilet. Okay, for skill number 5, cleans upper and lower denture. Focus points is you want to make sure that you use moderate temperature running water. Moderate means warm water. Make sure it is not hot. Make sure it is not cold. It is warm water. And then you want to make sure that you wet the dentures before you start brushing them. Run those dentures under that water first and then brush them. And then your last point I want you to remember is to make sure after you rinse that toothbrush, please put it in the basin. Leave it in the basin at the end. When you are locating the pulse area, the radial pulse, you need to use 2 fingers. Your index finger and the finger next to it to locate it next to the person's thumb. You would place your 2 fingers on the thumb side of the client's wrist. Not too high, not too low. And you want to make sure you do not use your thumb to take the pulse. And when you are all done counting it for 1 minute, you're going to really make sure you go say you wash your hands before you document. Very important that you wash your hands before you touch the pen or the tablet to document. The only thing that people miss in this skill is they count the person breathing going up and down. You do not do that. You only count their breath going up. And do not multiply times 2. You're going to count every time their chest rises or their stomach area rises. And then you're going to document that for 1 full minute. Focus point. Wash your hands again before you document. Skill number 8, donning and removing PPE, which is the gown and gloves. Most people miss this skill only because once you put it on, you have to consider this. The gloves are the dirtiest. They are the dirtiest things in this skill. So you want to remove the gloves first. Remove the dirty gloves first and then the gown. When you walk in the room with 2 shirts, not a gown, it's 2 shirts, and they pick the shirt they want to wear, put that shirt on the side of the weak arm. So you would sit that shirt down on the right side of their arm. That's going to remind you to put that arm in first, which the right arm would go in that shirt first. But remember, you take the gown off on the left, the strong side first. In the beginning of the skill, you must sit down and face them while they are eating. So please grab that chair and sit down. Don't stand up and feed them. And when they're eating, you want to make sure you ask the person on the bed, are they ready for the next bite of food or beverage? Give them time to chew and then say, are you ready for the next bite? And at the end, please make sure you clean their mouth. You want to remove that gown immediately. Once you begin that skill and you've gotten your supplies, remove the gown, keeping them covered, and put it in the designated dirty area, which is in the laundry basket, the linen hamper, before you start washing the face. The other area that most people fail is they forget to bring a gown in the beginning. Remember, you are taking off a gown and putting a gown on. You are giving a bath. Just like when you get dressed in the morning, you gather your clothes for the day. So you want to bring a gown in the room. And then the last part that most people do forget in this skill is once you use that towel to dry the arm, when you see it, remove it. Once you dry the arm, take it out immediately, because once you cover them up with the blanket, you forget to get that towel under their arm. Make sure that when you're looking for that brachial artery, in order to know where to put that blood pressure cuff, you want to feel in the inner area of the elbow. That is the closest to the body. So when you're feeling for that artery, the brachial artery, you want to make sure your fingers are closer to that person on the bed's body. And it's going to be right in the crease of the elbow. Do you know where your elbow's at? That's where the crease is at in the inside part. And then the other area most people miss is, remember, once you press start on that cuff, if it goes up to 200, you want to stop that machine immediately and uses the other person's arm. Make sure you zero that scale out. You start off with the scale at 0. And then ask that client to step in the center of the scale. Look down. Make sure they're in the center and they're not hanging off that scale a little bit, or they're not one-sided. They have to be in the center of the scale. And then you get those numbers, wash your hands, and document, and make sure when you write down those numbers, you don't forget those words, pounds or lbs. You're going to make sure they're flat on the bed. The bed is flat down. And then you're going to make sure that you ask them if they have any pain to let you know. Ask that several times if you need to. And then you're going to make sure you don't move that leg, moving that hip too far up in the air. We are not ranging the hip. We are ranging the knee. You gotta ask them if they're having any pain. Again, remember, if you have any pain, let me know. And then when you're moving that arm, make sure that arm goes up to the client's ear, not past the ear, not before the ear. It must stop at the ear area. And you must support their elbow the entire time. So you do need to rotate your hands back and forth as you're going up to support that elbow at all times. You gotta remember, guys, to put that bed rail up in the beginning. Put that rail up so you don't forget it. You don't want them to roll out of the bed and fall on the floor, so put that rail up. And then at the end, you want to make sure they're not smashing their arm. Land on their arm. Bring that arm, that shoulder out, and make sure you adjust their head. Most people forget this. Once you place that linen protector under their hip area, which is the buttocks area, remember, you're using that to protect the bed from getting wet. So it does get a little wet when you're doing this skill. You got to remember at the end, before you cover them up with that blanket, you see that protective linen, you need to remove it when you see it. So take it out. Don't let it touch your clothes because it's contaminating you, and put it right in the linen basket. Most missed areas is you need to know the difference between the person's heel and ankle. What is the difference? You are supposed to support at the ankle, not the heel. So make sure you know the difference. The entire time you're lifting that foot up out of that basin, you must support at the ankle. It's going to feel really weird to brush somebody's teeth, so I advise you to practice this now on several people. Make sure you brush all their surfaces. You're going to be nervous. Make sure you get all the tops, the sides, the bottoms, the insides, the outside. You're going to be nervous. Try to take your time because she's going to be watching you doing all areas. And then don't forget that tongue at the end. Another area people fail a lot is you got to hold on to that toothbrush. If you sit it down on the table, you sit it down on the sink area without having a protective pad under it, you have now contaminated that toothbrush. You got to hold on to it, or you need to put it on a paper towel or a washcloth. You got to make sure when you put that protective pad under her, remember to protect the bed so it don't get wet. You cannot leave it under her when you're done. It's wet and she's laying on wet linen. So when you get ready to roll her over after you've done the back, you see that protective pad, you take it. Don't cover her up with that blanket yet, because if you don't see it, you're not going to remember it. And then the other thing you need to remember in this skill is to make sure you don't overly expose her. You just need the area you're cleaning. So keep that sheet and that gown down to the hip area and the sheet to the knee area. When you roll her over, adjust that sheet again. Adjust that gown again. Don't overly expose her. Just like the skill with ambulation with the gait belt, which is also the transfer belt, make sure when you put it on that when you go to lift them up that you scoop on sides of the gait belt. Do not put your hands over to pick them up on the gait belt. Your hands go up under the gait belt to scoop them up. And then you want to make sure that when you transfer them to the wheelchair, that you ask them if their legs are touching the back of the wheelchair, And then when you sit them down, make sure their hips are touching the back of the wheelchair. This is the skill that no one likes. You gotta practice this skill a lot. I advise you to buy a manual blood pressure cuff and a stethoscope and practice on everybody you know. You're going to be very nervous with this one. Practice makes perfect. It is very difficult sometimes to hear the sounds you need to hear. You want to make sure that when you first put that blood pressure cuff on, you find the brachial artery. It's the inner aspect of the arm at the bend of the elbow, just like in manual blood pressure. So it's the closest area to the patient body, the inner part of the elbow. For that brachial artery, you go up to 160, no more than 180. If you hear a beat, immediately deflate that cuff and then pump it up to 200, but no more than 200. If you hear a beat at 200, the credential book does not mention this, but I would advise you to say that to the proctor, that you hear a beat at 200. I would remove it from that arm and I would take it to the other arm and start over on that arm. But again, credential book does not mention if that was to happen. And then you want to practice deflating that cuff very slowly so you can hear the first sound, which is the systolic, and the last sound, which is the diastolic.